The County of Santa Clara Public Health Department is committed to supporting its community members in making informed decisions about their health, and to local organizations to take action to protect the health of the people they reach. That's why we make public much of the data that we look at every day. There are two types of data when it comes to disease spread and its impact on the community: leading and trailing indicators, meaning indicators of what is to come and what's happening now. Think about leading indicators like a tsunami alert. It informs you if trouble is on the way. Examples of this that you can find on the public health website include wastewater data, or the number of emergency room visits for a respiratory virus. This includes COVID, flu, and RSV. Let's start with COVID and wastewater by going to secphd.org/data. If you see the lines in the graph going up, it means that there's more COVID being found in the wastewater. And higher concentration of COVID in wastewater means more people are likely to start getting sick. More people showing up to emergency departments for things like flu and RSV is a sign that more people are starting to get seriously ill. These are leading indicators because they are signs of what is to come. So why should this matter to you? If wastewater data shows higher levels of the virus, consider wearing a mask indoors, particularly if you spend a lot of time with elderly or immunocompromised people. Get the latest COVID shot and this year's flu shot. These leading indicators also help public health and local hospitals understand if they need to start preparing for a surge in patients, making sure everyone has access to the care that is needed. Let's move now to trailing indicators. To stick with the tsunami alert example, this is the impact of the wave itself. Examples include ICU bed capacity, hospitalization, and the number of people who've died. Essentially, trailing indicators are the impact of the virus. Hospitals are already full, and more people may have serious illness. Let's look at hospitalizations. People may be infected with a virus, but don't get sick enough to be hospitalized for a number of days or even weeks later. If hospitalizations are increasing, it means that the virus has already been spreading at a higher rate for some time. We often see deaths from a virus a few weeks later, from the most severe illnesses. If the number of deaths are dropping, it's a good sign that the wave of the virus may be over. It's important to note that if hospitals are overcrowded, it's even more important to wear a mask and take proper precautions like staying home if you're sick, because any reduction in disease is going to keep care available to those who need it most. Finally, trailing indicators help us understand how to prepare for and respond to the next wave of virus or emergency by seeing how our actions impacted this one. We hope this video helps explain the data that we look at every day for a healthier and safer Santa Clara County, and that it inspires you to keep checking back in to keep yourself and your family safer. Visit secphd.org/data